Hi and welcome. Thank you for joining me today. I'm Odile and we are going to be talking about and doing Pilates and stretching and working on heart health. So often when we think of Pilates or stretching, we tend to think of the musculoskeletal benefits, so the benefits that are great for our bones and our muscles, but we often forget about the benefits of the heart space and the way that the heart is opened up through the arteries and veins, and that helps to carry the blood up to the brain, like the carotid, the subclavian, which helps to really send the blood supply all the way to our fingertips, down our shoulders, and all the way down through our legs, through the femoral arteries. So the relationship between the musculoskeletal body and this arterial body is very, very important. It's often not talked about. And just for fun, just for the sake of feeling and sensing your body from a different headspace, let's practice our Pilates practice. Just a couple of exercises with that headspace. These exercises are particularly good for heart health and stretching. Okay, so what you'll need is a yoga block and a stretch band. Let's get started. First thing we're actually going to do is lie on our backs, and we're going to start in a bridge. So we know Pilates bridges, right? We know all about the core strengthening. We know about the strengthening of the hamstrings and the gluteals. But what if we thought about it with a little more depth? What if we thought about the gluteals and the hamstrings helping to open up the femoral artery space in the front of the body? How fantastic. So now we're giving more depth to our practice. It gives it a stronger why to why are we doing this. So I'm pressing my feet down. On my exhale, I press. And as I press, I feel my hamstrings and glutes. Fantastic. I'm going to not lift from my back, but rather I'm going to press down through my feet more to elevate my pelvis. As that happens, ooh yeah, I can feel a really nice quad stretch. I can feel the space at the front of my hip bones being open. And even if I don't know all the details of my anatomy, I can imagine these tubes that run down the insides of my leg here along the inner thigh line. And those tubes are the tubes that carry the blood down towards my knees and my shins and my feet. And I want that to be nice and open. And then I'm going to come down. So inhale to prepare. As you exhale, engage your core in whatever way you practice engaging your core. For those of you who are with me and follow my practice, you know I start with the pelvic floor, deepen into the transverse, feel a little bit of the deep muscles of the back body, so that's the co-contraction. But really, it's a co-contraction working with the hamstrings and glutes and coming down. Let's do two more like that. Exhale, engaging the core muscles towards the heart space while pressing my feet down and stretching my quadriceps and coming down. One more like that. Inhale and exhale, pressing up and coming down. And make sure when you're doing your breathing practice, particularly when you're doing stretching, that you're doing that longer, slower breath that's a little more powerful. That breath helps to reduce the stress levels and the stress hormones in the body. And with that happening, the body can send more blood supply to all of your extremities because the blood pressure isn't elevated. So that's good. That's what we want. Okay, so we're going to go ahead and put the yoga block under the bottoms of the feet. Again, taking that nice, long, full breath into the side and back ribs, supporting the back of our lungs. Exhale, press down. So I've got the yoga block under my left foot. We're pressing down into our yoga block. And because that left leg is high, I can feel the hamstring and glute on the left side. But in order to really open up the front of the right side, I have to really push the right foot down. So one foot is down, one foot is up on the block. Really getting a lovely stretch on the front of the right side and roll down. And you can even visualize as you're pressing up, the blood sending the pathways being sent all the way down to your legs and coming down. Visuals are really, really powerful for the body. If we can see it, the body will try to make it happen. So using that visual really heightens your body's acuity. And one more, press Press down, reach, inhale, and exhale. I can already feel my legs getting more warm. Probably that's all that healthy, good blood flow to my legs. Here we go, other side. So I've just slid the block under my right foot, left foot down. Inhale, exhale, long, slow breaths, bringing me more into a place of power rather than stress. Pressing down into my left foot, elongating the front of my left hip, pushing down into the right, and rolling down. 3 more like that. Inhale and exhale. Press and roll down. 2 more. Inhale and exhale. Press and down. And last one. Press. Oh goodness, my legs are getting tired. So the back of my legs are really supporting these front femoral arteries to be able to be open and long so the muscles stretch, clearing the pathways for those arteries to be able to do their job just the way they were designed to. What a beautiful mechanism, right? Okay, so we're gonna come on up and we're gonna go actually into our little clam position. So clam is often an exercise that's prescribed for people who have weak hips or missed leg alignment, sometimes even knee issues, right? Low back issues. Here, I want you to think of it as the opening of the front of that femoral artery and close. So we're not going to do a ton, but again, just deepening our practice of our Pilates practice so that we have a deeper sense of where we're doing this from. Why are we doing this? Why is it so important that our muscles and bones move in certain ways, right? Not just for our fitness level, but also for our overall health. 5 more. 5. And when you get up to the top, kind of hold it there for a moment. Feel the engagement so you can feel the stretch along the inner thigh. 3 more. Open and close. 2 more and close. Last one. Good job. And close. Let's go to the other side. So as you're doing these clams, of course, you're a perfect Pilates student. You're engaging your core, drawing your abdominals and pelvic floor center in and up to stabilize the pelvis and the spinal column so that as you're moving now your leg, opening, creating that pathway, you have a much clearer, solid sense of your whole trunk staying stable so you can isolate this leg move. 5 more. 5 and 4, and visualize it opening. Visualize that space. 3, that's it. 2, yep. Last one, just like that. Fantastic. And bring it down. Now we're going to stretch. So you're going to come on up and open. Excuse me. Open. Okay, sometimes life just happens, right? So I've got my left leg out, my right knee down, and I'm going to go back and forth. And as I'm going back and forth like this, it's giving space to that inner thigh in a different way than what we were just doing. Oh, we just can't get past technology. Oh my goodness. And 1 more. Fantastic. So feeling that space, feeling the energy move all the way through. Let's go to the other side. So now I've got my right foot down, left knee is down supporting me. This stretch isn't for everybody. If this is very difficult on the down knee, I will show you a different variation. So just stay here, forwards and back, and I'm rocking to give also space to my hamstrings and my glutes, feeling that inner thigh. 1 more. All right, so for those of you who would like a different variation, left leg is out to the side, right foot is into the inside, and I'm just gonna come over. So I'm literally turning my body to face the leg for a moment, and then I come up, and then I come forward. And come up, and turn, face the leg. So this is a little more hamstring. Coming up, and coming forward. That's it. Beautiful. Can you feel the stretch in there? Right, that's that femoral artery, the medial aspect of it, getting a nice release from the tight inner groin. So many of us have really tight inner thigh muscles. Come on up, let's do the other side. And that's just from repetitive hours of sitting or standing, typically repetitive stress, not moving enough, not stretching enough. Even though our outer hips tend to be really tight, coming forward. And we might notice them a little bit more. If the outer hips are tight, typically the inner hips are involved in some way as well. And one more. Yes. And then kind of pick a sweet spot. Like, where do you feel like, oh yeah, I'm getting the best stretch there. Remember that deep breathing, that calming the nervous system, dropping into the parasympathetic, where your body is actually in a place to shift. So the muscle tone will shift, the relaxation deep into the joint will shift. And it just brings that sense of well-being and reduces the blood pressure. And come back up. Fantastic. Okay, so from here we're going to finish with our rhomboid rows. The rhomboid rows help to open up the subclavian artery and even the carotid, so that the blood obviously can flow up to the brain more, and the blood can flow all the way down through our extremities more. After having stretched out our hamstrings the way we just did, if possible, straighten those legs. If it's not possible, go ahead and keep those knees bent. The rhomboid rows, very traditional. Inhale up tall, exhale, pull those elbows back. So you're working your back muscles, but not for the purpose of just working your back muscles. You're taking it one step further. You're working your back muscles so that you open and stretch the arteries in the front. And it's not the arteries, I guess, to be clear, that are getting stretched, although I'm sure they are. It's the muscles that kind of fold over those arteries that become tight and restricted. So can we open them, creating more space for the blood to flow? Okay, 4 more. Exhale. 4 and 3 and 2 and 1. All right. Wouldn't be Pilates class without chest expansion. I feel like this is kind of my catch-all exercise for so many things. So if you're up for it, crisscross your strap, stretch those legs forward and separate them so they're hip distance apart with those toes facing the sky. Here we go. We're pulling our arms back. 1 and 2. That's it. So same intention here. 3 of opening the chest, but this time we're not pinching the shoulder blades together. 4. We're just pulling the arms back and putting those rotator cuffs, giving them a job, right? And when they also participate, it opens that whole front area across the chest as well. 3 more. 3. Definitely getting warm here. 2 and 1. Excellent. And that's it. So I am so grateful that you were able to join me today, looking at your practice from a slightly deeper level. I know I always love these deep dives of going in a little bit further, looking for the why, asking the deeper questions, and feeling more holistic in my body. So have a wonderful day, and I look forward to seeing you next time. Bye, everyone.